Channel. In this video we will talk about Sjogren syndrome. Sjogren syndrome is an systemic autoimmune disorder. It is an immune mediated destruction of the lacrimal and salivary glands. So there is immune mediated destruction of the lacrimal and the salivary glands. When these glands are destroyed, then there is decreased production of the tears and saliva. Females are affected more as compared to the males, and the age in which this disease mostly starts is 40 to 60 years of age. It may be primary, that is, it is the only disease you are suffering from, or secondary, along with some other diseases like rheumatoid arthritis, Hashimoto's thyroiditis, etc. Clinical findings are: first one is keratoconjunctivitis sicca. It means that when there is dryness of the eyes, the patient feels like sand in the eyes. Furthermore, there is xerostomia. It means that the salivary glands are destroyed and therefore the production of saliva is decreased and leading to dryness of mouth. This dryness of mouth leads to dental caries, and this patient has poor dental hygiene. The parotid glands are enlarged, obviously because of inflammation of the parotid glands. And furthermore, lymphoid foci are seen on biopsy in these glands. There is dryness of other parts of the body, like dryness of the larynx, bronchi, skin, etc. Systemic features are also present in some cases, like interstitial lung disease, ILD. There is type 1 renal tubular acidosis, and in some cases there is chronic interstitial nephritis or CIN. In some patients you will see the features of vasculitis, and in some patients you will see the features of pancreatitis. If you want to diagnose this disease can be diagnosed clinically, but you will do some labs. On CBC you will see decreased HB and decreased WBC count, that is leukopenia. Furthermore, you will do RA factor. It will be positive in 70% of the cases, and ANA is almost positive in 95% of the cases. More diagnostic tests are anti-SSB, SSA, and anti-SSB antibodies, and in some cases you will find cryoglobulins, which are associated with lymphoma. So when these cryoglobulins are found, then it has strong association with lymphoma. Schirmer test. In this test we will use a filter paper, and we will see that if this filter paper doesn't get wet, it means you have dryness of the eyes. Then there is a test known as lip biopsy, and when lip biopsy is done, you will see lymphoid foci in the accessory salivary glands. So the most diagnostic test is lip biopsy, in which you will see lymphoid foci in the accessory salivary glands. You can also do biopsy of the parotid glands. Treatment. Treatment is symptomatic, like for eyes, you will use lubricants. Lubricants, for example, artificial tears, and you can also use cyclosporin 0.05% drops. For oral for oral dryness, you will use pilocarpine or cevimeline. These are cholinergic agonists. Furthermore, patient is advised to chew gums that are that do not have sugar, and this chewing of gums produces more and more saliva. And if other organs are involved, then like other autoimmune diseases, we will manage. For example, if there is arthritis, we use methotrexate once weekly. If there is interstitial lung disease, then we use mycophenolate, Mofetil or MMF.